Good night for everyone. So I think I start now, so you can get in slowly. Oh. Okay, we continue from yesterday. So, uh, okay, this is about this is also about ethical violation. Yeah? A suggested strategy in pre-report of ethical violation. Okay, before you all before you give a report to the ethical committee, you have to determine whether the matter truly involve ethics. Okay, and then the second important point is consult guidelines already available that might apply as a possible mechanism for resolution. Consult get as a new MHP. You have to better you consult guideline from your colleague from what is the how the procedure to report the ethical violation. Okay, and the several points you have to take note, and then another important point is evaluate the right responsibility and vulnerabilities of all affected parties. You have to evaluate what who involved in your case. Okay, let's say you want to report suicidal case, suicidal case of your client. You have to know who involved, which party involved in your case, whether police, family of the client, and so on. Yeah. And another case that organized another case that possible that possible that you will face organization culture. If you look at this case, a counselor in a community agency complained to the agency manager that Lucy Lips often talk in intimate detail about clients using their real name in the coffee lounge. The manager replied, "Don't be so critical. We all work here, and these people don't really care if we talk about them among ourselves." So you cannot disclose your client names. Okay, when you talk with your colleague, or we talk with other people, cannot disclose. Cannot disclose respondent name or any personal detail. This is what we call organization culture. Sometimes it's happened like this. Okay, giving of consent for surgery. This one, I think you already know. Giving of consent for surgery is under section 77. Yeah, where a mentally disordered person is required to undergo surgery, electroconvulsive therapy or clinical trial. Consent must be for any of them. Maybe you must sought the you must get the consent form by the patient himself if he is capable of giving consent as assessed by psychiatrist. Okay, B, if patient himself cannot provide consent form, okay, guardian can an adoption by his guardian in the case of a minor, or a relative in the case of an adult if the patient is incapable of giving consent. Usually, this minor is children, age below, below 17. Okay, below 17 and below. Okay, in the case of minor. Okay, another option is by two psychiatrists, one of whom shall be the attending psychiatrist if there is no guardian or relative of the patient available or traceable and the patient himself is incapable of giving consent. Okay, I think that this is important. So you must know that it is under section 77 under giving of consent for surgery. Okay, what else for purpose of subtraction? Okay, I think you should know this one. These three important point. Okay, under section 86, ill treatment of patient. Any medical director or person in charge of, or any officer of, or a staff or a person otherwise employed in or engaged by a psychiatric hospital, psychiatric nursing hospital, and so on, who ill treats or willfully neglect a patient for the time being receiving treatment for mental disorder as an inpatient in the psychiatric hospital and blah blah blah, or B, ill treat or fully neglect on the premise of which such psychiatry, the same thing, same to A, but this is outpatient, whether inpatient or outpatient, fully neglected by this hospital staff, psychiatry hospital, psychiatry by nursing, by nurse, by doctor, okay, neglected by this hospital staff. A person who ill treat or willfully neglects a mentally disordered person who is in his custody or under his care and protection commits an offence. Okay, a person who commit an offence under this section shall, on conviction, be liable to a fine not exceeding 10,000 ringgit or to imprisonment for a term not exceeding 2 years or both. Okay, a person who commit an offence, this is hospital staff that commit an offence regarding the neglect of the patient, whether in patient or outpatient. The fine is this 10,000 ringgit or the imprisonment for a term not exceeding 2 years or both. Okay, abatement of escape of patient, any attendant, nurse, servant or other person employed in or otherwise engaged by any government psychiatric hospital or gazette private psychiatric hospital who permit or abet the escape or attempt escape of any patient commit an offence and shall, on conviction, be liable to a fine not exceeding 5,000 ringgit or to imprisonment for a term not exceeding 1 year or to both. Okay, this is so under this section 87. It is about abatement of escape of patients. Okay. Okay, in this case, a client who had expressed suicidal ideation in the past showed uncommonly flat affect during a therapy sessions. This psychiatrist, Worry, his name, knew the client and experienced stresses recently and become concerned that his apathy and apparent peacefulness might indicate a resolve to end his life rather than a sign of improvement. His client vehemently deny any intent regarding self-harm. 15 minutes before she scheduled in of the session, the client stood up and calmly stated that he had to be somewhere else. This is case also about suicidal ideation. So ethical implication related to the element of ongoing harm or immediate danger appears to be possible. So this is about whether this is not whether this is about ethical implication that this psychologist, this therapist has to disclose this case to the top management, to the ethics committee. A difficult ethical issue as MHP must decide whether to violate confidentiality or not. Okay, so it's difficult because this therapist has to decide whether to violate confidentiality or not, whether to report to the ethics committee or not. So many flats, okay. Preparing in advance, making difficult decision under tight time constraint. This is not much to. I think crisis in. We have seen this kind of case before, crisis in the therapist's life. I think I move. Okay, what should you do when you observe an ethical violation or hear about an alleged unethical acts committed by a colleague? Should you infer that it is a one-time only mistake and forget about it? So what should you do when you observe ethical violation? This is several steps that what you can do. Identify the relevant ethical principle or law that apply to the suspected breach of professional ethics. You must first identify the relevant ethical principle that related to any action that you think is that you think it's a ethical violation. What is the ethical principle that broken by this by your colleague? Consider any cultural issues that may help to better understand the situation. Because like this, because you have to consider the cultural issues. Because for example, like kissing, like kissing between in Western population, kissing for them is normal. It's common. It's normal for them. Kissing between men and women. It's normal for them. But in our culture, in Malaysian culture, it's not normal. And then because it will be different interpretation among our culture. So this is example of the cultural issue. You have to look. Maybe if this kind of situation happen during therapy, it can give a different interpretation when it happen in our culture. But it's different in Western culture. For them, kissing between male and female is normal. So this is another example. This is another example of cultural issue. So you have to consider this element, and then assess the strength of the evidence. Okay, assess the strength of the evidence. Your evidence when you say that there is an ethical violation, ethical violation, from your colleague, you saw your colleague have done something wrong, have done something wrong. You have to assess the strength of the evidence first. your evidence maybe from your direct observation, the direct observation of a colleague engaging in unethical behavior, or maybe your evidence is a disclosure by a colleague that he or she had committed an ethical violation. Okay, you have been told by other colleague. Another thing is your evidence may be direct observation of a colleague suspicious but not clearly interpretable behavior. Another thing is a receipt of a credible second-hand reports of unethical conduct. Maybe you receive a second-hand report, maybe just a letter or just a document stating that there is ethical violation committed by your colleague. And then causal gossip about a colleague unethical behavior. Sometimes it's just a gossip. So you have to assess the strength of your evidence when you want to bring this ethical violation case to the ethics committee. Okay, and then another point is that consult with a trusted colleague who has demonstrated sensitivity to ethical issues. Consult with your trusted colleague, maybe your trusted colleague can help you and give you advice. Okay, this one is okay.
Doctor?
Yes.
Doctor, can I ask question? Doctor,
Yeah.
if when we are doing the treatment, so we have the therapist, male therapist, and the client is the female.
Yeah.
And then if the male therapist asks the client to massage his body, is it allowed or this is unethical behavior?
I think it's unethical behavior. What is the purpose of the massage? Is it part of the therapy? If it is part of the therapy, I think we can compromise. Ethics committee can compromise. Okay, but
Okay.
yes, is it part of the therapy or not? Okay.
That not a part of the therapy. Maybe just to rapport with the client.
No, cannot. Of course, cannot massage.
Okay.
Male and female, right? Even if male and female, of course cannot. Of course cannot. This is not appropriate. It's not appropriate.
Okay.
Even between female and female, we have to justify because it's out of the scope of the professional of your professionalism, because your task is to do therapy, not to do massage.
Okay. Noted, doctor.
Yeah.
Thank you.
I move to the next topics. Okay, can you see this topic 12? Can you see, student?
Cannot.
Thank you.
Can see, doctor?
Can see, Okay.
Can see.
Okay. For tonight, I finish all the topic because next week, we have presentation. Remember, we have presentation. Our second slot, second last slot and the last slot is for presentation. Make sure you know your dates. I showed you last time. First group, 27 December, and the another one is is third January like that. Okay. Okay, topic 12, issue of indigenization of psychology. Okay, issue of indigenization of psychology. This is indigenization is the act of making something more native, transformation of some service idea to suit local culture. Yeah, this is the meaning. Yeah, the general meaning of indigenization. It is a discipline that culturally appropriate or culturally sensitive. Discipline that culturally appropriate or to make it more culturally appropriate, or culturally sensitive to certain issues. Okay, and because of this, indigenization is a problem-oriented approach because it discuss or it go in deeper, on the issues of cultural appropriateness or cultural sensitivity. So that we call this indigenization as a problem-oriented approach, not theory-oriented approach, not just theory only. Okay, for example, like what is the country? Like let's say like Bangladesh. We want to observe or to study the factors that affect the quality of life among people in population in Bangladesh. Okay, so we have to look or go in deep the variable of poverty, for example, because Bangladesh people struggle with what we call their quality of life affected by survive to get food, okay, survive to get occupation and so on, not like quality of life when study quality of life in Western country, like in Western country, like UK, America, and so on, because their approach might be different. Their variable for quality of life measure is different. Maybe they are more they are more to. I mean the variable is different. Maybe the indicator of quality of life is not poverty in their country. Okay, so this is a problem-oriented approach. Okay, so don't confuse. This indigenization is not the psychology of Aboriginal. So there are four alternative approach or strategy in indigenous psychology to understand indigenous psychology. First, through linguistic. First, through linguistic. Linguistic is a cultural base, because from these four, some strategy can be considered as culture based, and some strategy can be considered as discipline based. Linguistic is a culture based. From culture, from the culture, from the linguistic approach, we can see what the scientists look at is the conceptual of the native language that capture the essence of thought, value, or behaviors within the culture. Okay, from the linguistic, they can capture. Yeah, they can capture. They can measure the sense of a thought, value, or behavior within the culture. And second one is empirical. Empirical is also culture based. Documenting culture. Again, empirical is a documenting. Documenting the cultural distinctiveness of indigenous value, concept, and behavior, which is different from language approach. Even though this empirical and linguistic also capture the value, concept, and behavior, but it's different with linguistic and empirical approach. Okay, the third one is applied. Okay, so any empirical, before that, empirical. Before that, so this empirical is a little bit different from it's different from linguistic approach. So empirical should know. Actually, empirical is based on a concern with verifiable by observation or experience rather than theory or theology. This is what we understand. We can understand with this empirical. Okay. Apply. Apply is a discipline based. So it is about a resolution of national social problem. This is a resolution of national social problem. Meaning that when we're doing research, when we're doing research in this aspect, applied indigenous psychology approach, it contributes to the resolution of a national social problem. Yeah. In the sense that it focuses the discipline of the local context. Okay, it focus the discipline of the local context. For example, I go back to the example of Bangladesh. Bangladesh population. Okay, so apply. So meaning that when we want to study about the quality of life of Bangladesh people, okay, we have to include. Yeah, we have to include what is the real situation in Bangladesh population. What is the important factor that contribute to the quality of life of Bangladesh people, such as I said just now, is poverty one of the variable that affect quality of life of Bangladesh people. So this is what we see applied. The solution of national social problem. Okay, it is focused on the national social problem, not the universal problem. Okay, and then the next one is a meta-discipline pragmatic. Meta-discipline or pragmatic is a discipline based. It's focused on the national discipline, on culturally relevant rather than on universal variable. This before that you must understand that pragmatic is dealing with things sensible and realistically in a way that it based on practical rather than theoretical consideration. Okay, I stress here, it based on practical rather than theoretical consideration. A meta-discipline approach, pragmatically considers the factor influencing the focus of the national discipline on culturally relevant rather than on the universal variables. For example, gitu. Okay, if you look at your apply and meta-discipline of pragmatic, it's almost it's like no, it's like overlapping, yeah. But actually, it's not, yeah. For applied, it is more to resolution of national social problem. Okay, without there's no culturally relevant. Okay, culturally relevant. This culturally relevant is under this meta discipline of pragmatic. Yeah? Focus on the national discipline on culturally relevant rather than on universal variable. This more cultural rather than applied approach. Yeah? I have an example here. Wait, okay. And for example, for applied approach, you can see that, for example, uh, the study of the immigrant adaptation, immigrant adaptation, second language learning among the immigrant, uh, okay, or the identity of the immigrant, yeah, something like that. It's different from meta discipline or pragmatic. Yeah? Meta discipline or pragmatic is more on culturally relevant. Yeah? Uh, it's more national discipline on culturally relevant rather than on universal relevant. It must be more cultural, more cultural issue. What is the example here? More cultural issue. Uh, uh, Maybe the adaptation with the traditional element of the traditional element among immigrant. This is more cultural as compared to the applied approach. Applied approach is not specific to the cultural element. It is more toward the national social problem. Okay, so indigenization, it has without and we also can understand indigenization from two sides, from two sides, whether it's without or within. Wait, I have to read for something. Okay, so in the indigenization, we can understand from two sides, yeah? Whether it is without and within. Without is like uh, how sensitive. We want to study the for example the adaptation of the. We want to know how sensitive. Uh, Apa? We want to know how sensitive the culture of the uh, sensitive to the influence. Okay, for example, how we want to study the sensitive to the influence of the Western issue on immigrant. Like let's say uh, Filipinos living in America, for example. So we want to know whether how the culture of American influence these Filipinos or Filipina people in America. So this is from the without perspective. If within is different from without. Yeah. Uh, within wait. Okay. Within is different from without. Just now without we want to know the influence of other culture. Yeah. Uh, in among immigrant, for example, okay, among Filipino, how they how they get influence from other culture in America, for example, when they living in America, within is different. Within is how, for example, such as issue of poverty, how this poverty, for example, in India, how this the issue of poverty affect the quality of life, the quality of life of people in India. Okay, meaning that the factor in their country itself, not the outside, not the factor from outside their country. Okay, this is a within. Hope you understand this. Hope you cannot differentiate between within and without. Okay. 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 Another thing is in the indigenization. Also, we can understand uh, from two okay, from these two root inside the culture, meaning that we can understand we can understand about the culture from let's say our culture, nation culture. Uh, we can understand from our culture. If cross indigenous approach, we understand how other culture influence our culture. So it has two ways here, to understand indigenization. Okay. So for P, cross indigenous approach, meaning that we compare our culture and other culture. Let's say we want to measure. Let's say we want to know about what? Uh, let's say we want to know about how we adapt with the new culture. Let's say immigrant in Malaysia, for example, how they adapt with Malaysian culture. So when we want to know how they adapt with how this immigrant in Malaysia adapt with uh, with Malaysian culture, uh, we have to compare with another group. Huh? Maybe we compare with American immigrant in Malaysia and Bangladesh immigrant in Malaysia, so that we can know what is the difference between these two group of immigrant exposed to the culture of Malaysian. So this is a cross indigenous approach because we have two group. Okay, this is indigenization that we can understand from this B. Okay, psychological phenomena is contact dependent. Actually, psychological phenomena is contact dependent, because uh, when we look at the intelligent measure in America, it's different from intelligent measure from apa uh, from different country. There's several intelligent measure actually, but in America, the intelligent measure including to be lucky, to bring good luck. Okay, they have this domain in their intelligent measure. So because their context is different, because their context, psychological context is different with uh, with other non-developed country. So the intelligent measure include this spiritual domain, to be lucky, to bring good luck. Because some measure, intelligent measure that used by non-developed countries, they don't have this to be lucky, to bring good luck. So because of the different context of intelligent measure between apa, between countries. So this example of the psychological phenomenon, which is context dependent. I don't have much on this topic 12. We move to topic 13, culture and abnormal psychology. Okay, I think we break 10 minutes. Break 10 minutes.
Okay, Doctor.